Hello, my name is Lauren, and I'm going to teach you a quick thing on reflexology. Reflexology is a type of body work that you could use to help yourself or others if you're having any sore spots or anything going on in the body. It can be done on the hands, on the feet, and on the ears. I'm going to show you a quick breakdown of how to find these different points and reflexes on the feet. So you will see I went to massage school, not art school, with this, but this is a profile of a foot, so looking at the inside arch. And then this is like a profile of a person, kind of a funky looking person, but hopefully you'll get the drift. So the sole of the foot is exactly like the anterior body or the front of the body, and then the top of the foot is like the posterior body or the back of the body. There's this thing called zone therapy that you can use as kind of like a little map. And if you were to draw a line at the base of the toes where it meets the ball of the foot, another line at the base of the ball of the foot where it turns into the arch, and then again at the top of the heel, you've got these 4 horizontal zones. And that actually breaks down into, again, this profile of a person. So right at kind of where the head and neck meet, and you've got the chest, which is correlating to the ball of the foot, and then the arch of the foot is sort of like our abdominal cavity. The heel of the foot is like the pelvic girdle. And then down here I've got another picture. I'm going to do that same little breakdown. So at the base of the toes, the base of the ball of the foot, and then the bottom of the arch, top of the heel. So you get these same little zones. And this is looking at the bottom of somebody's feet. So this is the bottom of the left foot, this is the bottom of the right foot. If you know your anatomy, you can actually break this down in a really detailed way. If you think about what's the most midline structure in our body, that's going to be our spine. That reflex is going to be down that medial arch, that inside arch of the foot, from the toe tip down to the heel. And then you can sort of go out from there. So if we look at that first section, that first zone, that's head and neck reflexes. So again, brain's pretty midline. That's going to be in the big toe. Eyes are coming a little bit more lateral, a little more off midline. And then ears. So these second and third toes correlate to your eyes. The ring toe and pinky toe correlate to your ears, which that looks kind of funny, but there you go. Ears, eyes. Then you've got also some nice sinus reflexes here. So if you were to work the tips of your toes down towards the ball of your foot, it actually can help to clear any congestion or any sinus stuff that you might have going on. In the second zone, you've got your chest. So we've got nice lung reflexes here. You've got a heart reflex. Again, some charts might show that you've got half of your heart on each side of midline. Some will just show it's in the left foot. And of course, there's other good stuff in here too that we could work. But if we move down into the third zone, this is your abdominal cavity. So this is the arch of the foot. I've got stomach and spleen reflexes, which are sort of midline and a little bit more to the left. You've got liver and gallbladder, which is more on your right. So that kind of takes up some space over there. You've got a lot of intestine reflex. We've got 18 to 21 feet of small intestine between a couple points on our abdomen, and then we've also got 7 and 9 feet of large intestine. So on the outside edge of that left foot, you've got your descending colon, transverse colon, more transverse colon on the right foot, and then ascending colon. So it's like this nice loop here, and then you've got all that nice 18 to 21 feet of small intestine sort of zigzagged through that whole area. Moving down into that fourth zone, this is the heel of the foot and the pelvic girdle. So we've got a uterus reflex for women, prostate for men on that inside heel. Then you've got testes or ovaries on the outside heel, depending on the gender. Then you've also got a bladder reflex, which again is pretty midline. If you have any low back pain or any hip pain, you can actually do some nice squeezes into your heels or just work from the top of the heel to the bottom of the heel. That kind of can help to clear out any congestion or soreness there. And of course, working any of these areas that you might have something going on, it can just provide a little bit more health and balance for the whole system. There's 7,200 nerve endings in each foot, so there's a lot of good you can do with it. But I hope you enjoyed this video, and I hope you have a great rest of your day.